Select Standby. Adjust the gain of the signal for optimal view and inspect the quality of the signal for 1 to 2 minutes. If leaks are detected, a warning will appear on screen, counting the leaks from the probe. A few leaks in the first 2 minutes are normal until the system stabilizes. If leaks continue and occur more than 2 leaks a minute, try the following steps. Fasten tubes tightly to the device. Check if the connector is secured to the probe. Deflate and replace the probe. Reinflated, resume standby. Deflate and replace the tube. Reinflate and resume standby. Signals data is not being recorded during the stage, and probes are not considered used. Once signals are stable, press Go. A recording signal icon should appear pointing at the hard drive. Initialize the stopwatch by clicking the stopwatch icon. Follow time progression on the bottom part of the screen, as the baseline measurement should be 6 minutes long. Just before starting the occlusion phase, adjust the sensor gain to 20,000 and the time base to 15 seconds. This will allow us to assess the quality of the occlusion period. Inform the patient you're about to occlude. Rapidly inflate the blood pressure cuff 60 mm of mercury above systolic blood pressure, but not less than 200 mm of mercury and not above 300 mm of mercury. Press the stopwatch button. This will set a timer for the 5 minutes of the occlusion phase. Compare the signal between both probes. Notice the occlusion is complete when there is no correlation of peaks between the occluded and non-occluded hand. If the occlusion is not complete, increase occlusion by 50 mm of mercury up to 300 mm of mercury. Occlusion duration will remain 5 minutes, even if adjusting was needed just before the end of occlusion time. Inform the patient you are about to release the occlusion. The study is not yet over, and the patient must remain still. Exactly after 5 minutes, release the cuff's pressure. Click the timer icon to reset the time. Set the gain back to fit the screen and the time to 1 minute. Just before the end of the post-occlusion period, inform the patient the study is about to be done. When the stopwatch icon is blinking red, press the stop button. The probes will automatically deflate and the recorded study will disappear from the screen. Remove probes and anchors from the patient. If this was the last study of the day, turn off the device and the computer. Gently wrap the tubes around the device. Keep probes connected. You can now continue to analyze the results. More on this in the next video.